Good evening, guys. I have discussion for you. We're discussing Medicare provides a strong medical foundation, but it leaves retirees exposed to major gaps. So we're going to discuss those gaps tonight. For A, please join me in tonight's presentation. Here we go. In short answer, Medicare provides a strong medical foundation, but it leaves retirees exposed to major gaps, especially dental, vision, hearing, prescription drugs, unless you add Part D and all along and all long-term custodial care. So most people must layer Medigap or Medicare Advantage on top and budget carefully to avoid large unexpected bills. Why retirees feel Medicare falls short. Many older adults enter retirement assuming Medicare works like employer insurance they've had for decades, but original Medicare was designed in 1965 for hospital and physician care, not for routine age related services retirees use most often. The mismatch becomes painfully clear when people discover that cleanings and fillings, dentures, eyeglasses, hearing aids, and long term care are almost entirely excluded. These exclusions these exclusions matter because they do not or they're not fringe services, they're core, maintaining independence and mobility and quality of life. Dental infections can worsen chronic disease. Untreated hearing loss accelerates cognitive decline, and vision problems increase fall risk. Yet Medicare covers these only in narrow medically necessary circumstances. Prescription drugs are another surprise. Medicare does not include drug coverage unless you buy Part D or enroll in a Medicare Advantage plan. For retirees with chronic conditions, this can mean thousands of dollars out of pocket costs without proper planning. What makes the choice difficult? Retirees must balance predictability versus flexibility versus premium cost. Medigap offers stability, no surprise bills from 20% coinsurance, but premiums can rise with age and you still need separate dental, vision, hearing coverage. Medicare Advantage often looks cheaper up front, but network prior authorizations and annual benefit caps can complicate care, especially for people with multiple specialists or chronic conditions. Long-term care is the biggest blind spot. Medicare covers only short-term skilled nursing after hospitalization. Custodial care, help with bathing, dressing, eating, is 100% on you unless you qualify for Medicaid. Practical steps retirees should take now. 1. Map your likely needs: medications, dental work, hearing aids, contact surgery, travel habits, chronic conditions. 2. Calculate total annual cost: premiums plus deductibles, co-insurance, plus drug cost, expected dental, vision, hearing expenses. Compare Medigap premiums across carriers. Identical plan letters can vary by hundreds per year. If considering Medicare Advantage, check your doctors, hospitals, and medications in the plan's network and formulary review authorization rules. Plan for long-term care. Explore hybrid long-term care insurance and annuities with LTC riders or Medicaid planning if appropriate. Risk limitations and red flags. Rising Medigap premiums can strain fixed incomes, assuming dental, vision, and hearing are covered, leads to some of the biggest retirement budget shocks. Switching later isn't always easy. Medigap underwriting can deny coverage or raise premiums if you try to enroll after your initial window. Medicare Advantage out-of-pocket caps vary widely. Some benefits like dental have low annual maximums. Bottom line, Medicare is essential but rarely significant on its own. Most retirees need either Medigap or Part D for predictability and provider freedom, or carefully chosen Medicare Advantage plan for lower premiums and bundled extras. The right choice depends on your health profile, budget, and how much you value unrestricted provider access. Most Americans overestimate Medicare's reach. Only about 26% correctly know Medicare covers roughly 2/3 of typical retiree health costs, leaving the rest to premiums, copays, prescriptions, dental, vision, and hearing and long-term care, a gap that can mean tens of thousands in unexpected expenses. Quick summary and why it matters. A 2025 public summary found only 26% of U.S. adults answered correctly when asked how much Medicare covers a typical retiree's health spending. That misperception leaves many households unprepared for the 1/3 of retiree health costs Medicare doesn't cover. Fidelity's 2025 estimate puts lifetime health spending for a 65-year-old at about $172,500 per person, including long-term care. Underestimating Medicare's gaps can mean being off by tens of thousands. Snapshot what people get wrong and evidence. Long-term care confusion. Many believe Medicare will pay extended long-term care. Research shows a large share of people are mistaken, and this misperception helps explain low private LTC insurance take up widespread unfamiliarity. Other surveys find large fractions of adults unfamiliar with Medicare parts, premiums, and drug coverage details, reinforcing the coverage reinforcing the knowledge gap. Comparison table, perception, reality, impact. Key considerations and risks. Income related premium surcharges. IRMAA can raise Part B/Part D cost based on prior income. Timing matters. Retiring before 65 creates costly coverage bridge. Cobra Marketplace. Behavioral risk. Believing Medicare is complete reduces demand for LTC insurance and savings, increasing reliance on Medicare for family supports. Next steps I can take you. I can estimate likely annual and lifetime out-of-pocket exposure and compare Medigap versus Medicare Advantage options for your zip code using your age, retirement date, and current coverage if you want. Okay, so that is it for you. I will see everybody after dinner for shows. For now, Gator Wellness. Take care, folks.